Well, good afternoon, everyone, and welcome to this webinar on procurement this afternoon. Thanks for those that are joining from all over the world. I'm Mike Brannigan-Harris, CEO of Device Access. I'm just going to do a brief introduction into us, and then I'm going to introduce you to Sarah, who's joined us today, a procurement specialist who's going to be talking about the complexities and the ways of navigating procurement in the NHS. I'm Mike Brannigan-Harris, CEO of Device Access. Just a bit about us. I know you may have just seen the video, but we're a market access consultancy based in the Southampton Science Park, and our mission is to help companies like yours navigate the complex landscape of NHS adoption. And that's partly why I've got Sarah with me today. What do? We help to predominantly get national recommendations for technologies through NICE. We've helped over 45 companies through NICE in the last 11 years. We have a license with NICE to do assessments, to look at evidence and gaps in your evidence and economics to prepare you for a future NICE evaluation, as well as engaging with commissioners and payers. We have access to 1.3 billion NHS patient records with a license with NHS Digital, so we fully understand how patients are treated and managed today, and we look for opportunities as to where your technologies can improve patient outcomes and improve the lives of patients, providers and payers. And again, part of that is rolling that into helping you demonstrate your device's real value. We've had some front page news over the past few years. This one was a big one around a new treatment for prostate that we got recommended by NICE. And where we work predominantly is around this PICO framework. So if you were to engage with NICE or NHS England, often they'll ask, what is your PICO statement? That means who needs your population, who needs your medical device? What does your new technology do? What happens today? How are those patients managed today? And what is the outcome? And we work in the complex area of these three blocks here, understanding the population that would benefit, trying to understand how those patients are managed together, and then the outcome benefits through all the work we do in economics, business plans, etc. But obviously part of that is now trying to explain those benefits into a complex healthcare system, and part of that is procurement, which is why we've got Sarah with us today. So the principles of how we work with companies are not marketing. Marketing is product, price, place, promotion. We're a great believer in these principles of market access, which is where you can demonstrate that your product benefits patients, benefits care providers, and benefits the person that's paying the care provider to treat the patient. Without any further ado, I'm absolutely delighted to have Sarah with us today. Sarah has an extensive background in nursing from the NHS. I met Sarah years ago when she was working in the world of selling medical devices very successfully. And Sarah took her own initiative to try and understand the procurement processes and tendering in a way that it is second to none. So I'm absolutely delighted to bring Sarah on the call on this webinar this afternoon. Again, extensive background, understands medical from her nursing background, and has been working with us to help our clients to navigate procurement. So without any further ado, I'm going to hand over to Sarah, and she's going to take you through these great slides. So over to you, Sarah.
Well, thanks, Mike. Thanks for the great introduction. And hello, everyone, and thank you so much for joining us on this webinar this afternoon. So NHS procurement and tendering is a really large topic. So this is just a reasonably short presentation. So the aim is to give an overview to provide the basic working understanding of the NHS procurement landscape and what is required from suppliers to successfully complete a winning tender bid. Each of the areas that are covered in the following slides actually have so much more depth than can be covered today. So in the final slide, we have got links to further resources and also our contact details if you want more information about any of the topics we cover in brief today. So the key learning points that we're going to cover are the current NHS procurement landscape, how and where tenders are advertised, and tender requirements, and that's going to include social value, net zero, modern slavery, and labour standards. Next slide, please, Mike. So the Green Paper. Now that the Brexit transition period has ended, and we are now out of the EU, the government have taken the opportunity to review and make changes to the public procurement regulations. At the moment, they've just taken all the regulations that we were bound by in the EU and moved them into UK law. But we now have an opportunity to make our own. So the aim is to make procurement easier, faster, to focus more on value for money, to make opportunities more accessible for SMEs, charities and social enterprises, and also to encourage innovation. So the Green Paper invited feedback from interested parties, and the consultation closed in March 2021. So we don't know yet which, if any, of the changes that were proposed in that paper will be implemented or when they'll be implemented at this point. So I'll be watching with interest and will update you as and when changes occur and what impact they're going to have. Integrated care services are also a recent change in the NHS landscape. You may have heard of them. These are related more to healthcare services as opposed to products, and how they are provided and procured. We're not going to be covering this today, so to help you, there's been a consultation on this, and there's a useful link on the final slide. Next slide. So it's important to understand who's actually buying. Public sector bodies are organisations run by the government, and they're bound by procurement laws. And there are several, but they include the Public Contracts Regulations, known as PCR 2015. So public sector bodies include the organisations that are listed here. Private hospitals and clinics are not subject to the same procurement regulations, and they'll have their own guidelines to follow. I've put NHS supply chain up on the list. The category towers are not technically public bodies because they're private organisations awarded the business within the respective category tower by the Department of Health. I've included them though because they actually use the public contracts regulations and tender under that legislation. They also have to answer to the Department of Health. Next slide. Procurement departments in the hospital, when approached by either a clinician wanting to purchase a product or by the company representative, will often ask, is it on a framework? So what does that mean? A framework's an agreement for selected products and services from either sole, ranked or multiple suppliers. They ensure a compliant purchasing route for the hospital. It's usually a 4-year agreement. Once they're awarded, you're unable to add your products to it. And there are no guarantees of sales, even if you're awarded onto the framework. Next slide. So we've had a changing landscape. This changed significantly a couple of years ago. Looking very specifically at products purchased by hospitals in England, NHS England launched a new operating model on the 1st of April 2019. Previously, we saw 40% of the 5.7 billion the NHS spent on everyday products. They went through NHS supply chain. 20% was from hospitals directly, and the other 40% was through other routes, mainly other procurement hubs, of which there were in the UK multiple different hubs. The new target is now for 80% of the spend to go through NHS supply chain, with just 10% from hospitals directly and 10% through other procurement hubs. So this is a massive shift in where they're looking for the spend to be utilised. Next slide. So we've got a new operating model. Sometimes they call it the NOM because it was originally the future operating model that they nicknamed the FOM. The NHS is renowned for loving its acronyms. So this is a picture of the new operating model. Supply Chain Coordination Limited is a company that's wholly owned by the Secretary of State for Health and Social Care. The company acts as the management function within the NHS supply chain operating model. Underneath that, we have the category towers and logistics, and then the transactional services and the supporting technology infrastructure. Next slide. So this is a list of the category towers. They actually then manage the product group, so you can see which tower your product may fall under. The companies managing the individual category towers were awarded the business by the Department of Health in 2018. It was a 3-year contract with an option to extend for a further 2 years. So they won the award through a tender process themselves. So this is looking to be renewed by 2023. Next slide. So the way it's funded, that's also changed. NHS trusts now pay for the new operating model. To simplify the funding flow and provide product cost transparency, the operating cost of the new operating model is top sliced prior to flowing into tariff and allocated directly to the new operating model. The money is taken from hospitals' funding prior to them receiving it based on the size of the trust, but it's regardless of how much they purchase through the category towers. NHS hospitals can opt out, however, they all use NHS supply chain to some degree or other for their purchasing. So this is a change from the previous model used by NHS supply chain, where an additional variable margin was added onto the cost of products from the cost that they bought from the supplier. So now the buy price equals the sell price. The price you sell to NHS is the price, NHS supply chain is the price the customer then pays. So what does that actually mean for a supplier? Hospitals are incentivised to procure through NHS supply chain as they're paying for the service anyway. So they will, in general, demand that this is how they purchase the product. So it's now become important to have your product awarded onto a framework with NHS supply chain by means of participating in a tender to make the route to market easier. Many organisations have their own portals where their opportunities are also published, though including those that are below the threshold. However, they're still subject to procurement laws and have to publish on the government portals, Finder Tender and Contracts Finder as well, which we'll come on to. Wales, Scotland and Ireland all require products to be listed on their frameworks for hospitals to purchase products. These are free to join and you can save searches and receive email notifications relating to these searches. There are portals for consortiums and hubs such as Health Trust Europe, East of England, NSHLPP, Procurement Hub and Places for People group. It's really important to monitor the portals for opportunities, especially for prior information notices. Also to explore the current market and establish what frameworks are already in place and when they're due for a renewal to ensure appropriate business planning. It might be in some instances, if you have an innovative product, that there is not a framework for your product to sit on already. In that case, it can be still purchased directly, or there can be an opportunity for when the next framework that it may be associated with, it can actually be then created a separate lot for that product, and we can then look to get innovative new products put into lots outside of the original framework when they're tendering for the new renewal. So early engagement with the procurement bodies is so valuable. It means that opportunities aren't missed. It ensures that you've got scope for your product within their framework. And we do offer a service to help suppliers with this valuable early engagement. So every tendering organisation also have their own portals or tendering platform where the tender itself is available. And this is where you access the tender documents and submit your tender bid. Some of them are challenging to navigate if you're unfamiliar with them, and we can help you with that if required. Next slide. Spend comparison service. This was launched on the 1st of August 2019. It provides a benchmarking and spend analytics on purchase order data from across all of NHS England providers, including acute hospitals, ambulance and mental health trusts, and it's provided by NHS Digital. The service means that procurement departments can compare the price they are paying against the national benchmark and then use that information to negotiate pricing with suppliers. Next slide. So contract thresholds. So a contract itself, it's calculated over the total contract period, not per annum, and that's usually 4 years, and it excludes VAT. If the contract is under £10,000, they can request for a quote from suppliers directly. Ideally, they look for a minimum of 3, and they may do this via a portal such as Multiquote. If the contract value is above £10,000 and below the tender thresholds, then it must be advertised on Contracts Finder. There are different thresholds applicable for different types of work, i.e. products or services. These values have been, and thresholds have been lifted directly from the original EU values post-Brexit. And the number that's most applicable to medical device suppliers is £122,976. So if the contract is above this value, it must be advertised on Find a Tender and also on Contract Finder for the UK. It will be advertised on TED for European tenders, which stands for Tenders European Daily. TED is the online version of the supplement of the official journal of the EU, known to most as the OJEU. Registration on Contracts Finder and Find a Tender is free. You can search for opportunities and set up a profile. You can have email alerts sent to your inbox for new opportunities based on any saved searches. And the links for both portals is on the final information slide. Next slide. And next slide. So common procurement terms, a PIN. You might hear someone say there's a PIN being released. A PIN is a procurement information notice. And this is an information notice made before they actually publish the contract notice. It's often accompanied by an invitation to express interest in the opportunity. When a contracting authority releases a PIN, it's also able to reduce the timescales for response to the contract notice, and it can be used as a call for competition. Qualification. Suppliers are required to complete self-declaration to qualify they meet a set of minimum criteria for the procurement process. Some of these terms are now not officially used, but procurement departments sometimes still refer to them. So this is to clarify what they all mean. So a PQQ is a pre-qualification questionnaire, an SQ is a selection questionnaire, and ESPTD is the European Single Procurement Document. An RFI is a request for information and is often sent out following an expression of interest to a PIN. It's a means for buyers to engage with suppliers and to assist with the development of the opportunity. Contract notice, or an ITT, which is an invitation to tender. This is a notification of a procurement contract opportunity and a call for competition. There are different types of contract notice. The most common one is the open procedure, which is when any interested party can submit a bid. Next slide. So contract award notice, this is official notification of the tender outcome, and this has to be published in the same way as the contract notice, so on Contracts Finder and or Find a Tender. Then got a VEET notice, which is voluntary ex-ante transparency notice. That's to inform the market of an intention to award a contract without having published a contract notice. And there will be a reason for this, and they have to state clearly why. It could be because there are no other suppliers who can provide the product or service following a PIN, or it could be extreme urgency. And we've seen several of these recently due to the COVID-19 pandemic. Standstill. Once the tender has been evaluated and the decision made as to the contract award, all participating parties are notified of the outcome of the tender exercise. It's also known as an award decision notice or standstill notice. There then follows a standstill period of at least 10 days before the tender can officially be awarded and signed. This is to allow any challenges related to the outcome to be made. Appeals can be made up to 30 days from the date of the standstill notice. And DPS, Dynamic Purchasing System. This is a two-stage process that's run completely electronically. What happens is the contracting authority will outline the scope, and then this can be as broad or as specific as they want and made up of one or more lots. Interested parties then demonstrate their ability to provide the goods or services required, and then they are added to the DPS. The number of approved suppliers is unlimited, and also, unlike a framework agreement, when new suppliers can't be added, new suppliers can be added to the DPS at any time within some set time periods. The second stage is when the contracting authority then requests bids from the approved suppliers when they have a suitable opportunity that needs fulfilling. We've seen a massive increase in requests for DPS since the COVID pandemic, particularly around the market of PPE. Next slide. So once you've found a tender opportunity and you're wanting to then submit a bid, there are various mandatory requirements. It's really important to make sure that you know what requirements are going to be asked for in a tender, so you have them ready and available. So they include your relevant ISO certification, which might be 13485, 9001 or 14001, for example. The product CE certification, and coming soon here in the UK CA mark, which is by January 2023. All products in the UK also need to be registered on the MHRA portal by a UK responsible person. You need to be able to demonstrate sound financial standing, and you need evidence of policies and procedures in place and compliance with legislation. So, for example, your indemnity and liability insurances. Next slide. So 4 new public procurement assessments that suppliers are being asked to complete as part of the tendering process. They are carbon waste and water, social value, labour standards, and modern slavery. Currently, what's happening is suppliers are sent a link and a code from the contracting authority to complete the assessment, and successful award is dependent on them being completed satisfactorily. What I've done is I've got copies of those questionnaires, and I work proactively with suppliers to ensure that when required to complete these assessments, all elements are covered and in place already. To try and put the requirements in place in the 4 weeks that a tender is live for is a huge challenge and won't necessarily provide the robust evidence to support the tender bid. Putting processes in place early and collecting evidence now so that there is a wealth of data that you can call on to provide the best, that's the best course of action for a supplier. Next slide. So looking at social value. The Social Value Act became law on the 8th of March 2012. It required public sector organisations to consider in its procurement how suppliers can deliver services that enhance the area and people with whom they will be working, including the following factors: economic, social and environmental. Next slide. So this was really significant. January the 1st, 2021 saw the implementation of the procurement policy note, taking account of social value in the award of central government contracts. The PPN was published in September 2020. So the link on this slide takes you to the full notice and also the government supporting documents on the social value model, which we'll talk about shortly. The main impact of this procurement notice for suppliers is that consideration that we saw in the Social Value Act has been replaced with a requirement score. Social value now carries a minimum score of 10% in public procurement tenders. Contracting authorities are required to use a qualitative approach as opposed to a quantitative one to ensure that there is a level playing field for all suppliers. Just to note, NHS supply chain are going to be making this mandatory from April 2022. Next slide. So social value requires consideration of the impact the business has on its own employees, how it trades, and the wider community it serves and operates in. The government has identified 5 themes and 8 outcomes, and these are listed on this slide. Contracting authorities are either using Tom's calculator, which are themes, outcomes and measures, or asking scored questions based on these themes and outcomes, or using the public procurement assessment that we talked about on the previous slide, or using this social value model as a means for suppliers to provide evidence and demonstrate their commitment and achievements around social value. There is a lot of work going on at the moment in the sector around social value to try and create a uniform way of asking suppliers for this information. That hasn't been completed yet, and there's another consultation going on around this at the moment. And I'm keeping very closely attuned with what's going on there. Again, for this requirement to try and demonstrate social value in 4 weeks when a tender's released is a really challenging exercise. So if you need more information, help or support, or develop the evidence around this, please just get in touch. The other big topic at the moment is net zero. So delivering a net zero health service, this was a report that was published in October 2020. It announced the ambitious target for the NHS to become the world's first carbon net zero national health system by 2045. The NHS is the UK's largest employer, and the NHS in England estimates that it is responsible for around 4% of England's carbon footprint. So their plans are going to have a significant impact on the UK's government target for a net zero UK by 2050. They identify climate emergency as also being a health emergency. Reducing carbon emissions will save lives from reduced air pollution, increased physical activity and better diet. Next slide. In the Delivering a Net Zero Health Service report, it stated, before the end of the decade, the NHS will no longer purchase from suppliers that do not meet or exceed our commitment to net zero. Tenders already have this as a scored element, and we can expect the weighting allocated to increase. And suppliers are going to need to get on board and work towards net zero now. Next slide. So taking it another step further, we saw in June this year, 2021, a procurement policy notice released from the Cabinet Office called Taking Account of Carbon Reduction Plans in the Procurement of Major Government Contracts. So this notice requires all public bodies to apply the PPN to any contracts with a value over 5 million per year from the 30th of September 2021. This will apply to frameworks, as while an individual supplier may not be supplying 5 million individually, the overall value of the contract will exceed 5 million. NHS supply chain will also implement these PPN requirements in the same way they're implementing social value, modern slavery and labour standards into tenders. Because if they want to be awarded the contract to continue managing the category towers, when that comes for retender, the Department of Health will expect them as a supplier themselves to the NHS to meet the requirements. To be able to do this, they need suppliers on the framework to be compliant. In terms of how this will be asked for in tenders, we don't know yet. However, these requirements are mandatory. So I suspect, having being an experienced tender bid writer, I think we're probably going to see this as a pass or fail. So you must do the following. You must report scope 1, 2 and some of scope 3 greenhouse gas emissions. You must commit to being net zero by 2050. However, for the NHS, this is 2045. You must produce a carbon reduction plan. You must publish your emissions and your carbon reduction plan on your company website. And you must detail environmental management measures that can be applied in the performance of the contract in your carbon reduction plan. What it doesn't elaborate on is how effective your carbon reduction plan is, or on your emissions reduction in terms of how this may be scored in procurement tender notices. However, I believe that we'll see this being required, and I think there'll be future PPNs that will be released and then more significant tender weightings. Next slide. So this diagram shows in a blue circle, the dark blue, you can see that's the NHS carbon footprint plus emissions. And that's predominantly, it's from its supply chain. So this shows you very clearly why the NHS needs supplier support in the net zero target for them to be net zero by 2045. Next slide. Suppliers to most frameworks are already being asked to complete the 2 assessments on modern slavery and labour standards by tendering organisations, including NHS supply chain. Labour standards and modern slavery assessments involves close engagement with employees and the whole of the organisation's supply chain, including training, support and audit. There is a requirement to have a modern slavery statement, even for small organisations who do not meet the 36 million turnover threshold if you're supplying to a public body. This has very specific elements that need to be documented. It needs to be produced every financial year and also published on the organisation's website. Supporting policies and procedures need to be in place to cover all these elements, including discrimination, modern slavery, human rights and conditions. Supply chain mapping tier 1 and beyond, along with supplier auditing, is required. Identifying supplier location and then the risk factor associated with that as per the Global Slavery Index is required. This then leads to risk assessment and documentation of how these will be mitigated and monitored, and the setting of key performance indicators. Organisations need to also demonstrate that they are providing training on both labour standards and modern slavery to employees. Next slide. So this is kind of old news, standards adoption in the NHS. The government's e-procurement strategy, known to many as Scan for Safety, was published in 2014 and mandated compliance with GS1 and PEPL standards if you're supplying products and services to the NHS by 2019 or 2020. It's mandated now, and GS1 standards are the set of standards chosen by the Department of Health and Social Care for use for barcoding of products. And PEPL, which is Pan-European Public Procurement Online, is the set of standards chosen by the Department of Health and Social Care for e-invoicing. The reason for doing this is using standards means that there's a compliant way for cross-border e-procurement, and they're used to exchange purchase orders and invoices, etc. Next slide. So in conclusion, participating in tenders and being successfully awarded is the best way to sell products and services to the NHS. And it's essential to implement procedures and processes to be able to demonstrate compliance with the procurement requirements and to ensure tender success. Next slide. And here's a list of further resources, as I mentioned, through the presentation, and also our contact details. And that's my presentation. So over to you, Mike, for maybe any questions.
Yeah, no, thank you so much, Sarah. What an interesting, what a very interesting lot of detail in procurement. Goodness me, has it changed since, you know, I don't know, 15 years, 20 years ago when I was out selling medical devices. It was relatively straightforward. You'd, you know, talk to the operating theatre manager through the surgeon, they'd go down and place an order on the system. And I think some of the things that I took out of the presentation, you know, I've got a few notes here, but just for the participants on this, please feel free to ask questions on the chat box under the Q&A box. But I've got a few things to ask Sarah whilst people are thinking of some questions for you. What I found was, just going back to what I was saying, this whole move to 80% centralized purchasing, that's massive. I mean, you know, I ask a couple of questions out of that, really. One is that, you know, what is the role of procurement managers in hospitals if they're going to procure things at that level, 80% of it centralized? I mean, what does it mean for these procurement departments in hospitals that used to make those buying decisions and companies used to negotiate with? What's your thoughts on that?
Well, there is still a role there, because especially for a lot of the generic products, there's still a large number of suppliers that are all listed on those frameworks. So while they need to purchase through this supply route of NHS supply chain, and that's where they're being funneled to buy it from, they've still got a massive choice of which products to buy. And we know it isn't a case of one product fits all. And there are always nuances and individual requirements within a hospital itself, as well as from hospital site to hospital site. So the procurement departments there, while they may be obliged to purchase through NHS supply chain, they still then need to choose which of those products that are listed on the framework, which have a variety of pricing, which meets their needs within their hospital best.
So I guess it's taking away the power of these, you know, these individual hospitals. I mean, I don't know how rife it was now, but obviously years ago, companies would do individual deals with hospitals for the same product in the same healthcare system, which I know with some of the high cost devices are sort of things that we get involved in. Some of them where, you know, they basically reined everybody in to buy through a central procurement process. So, you know, you wouldn't get one manufacturer selling a product for a lot more money in one hospital because they bought more of them than another. But do you think this has happened because of that sort of pricing variant?
Absolutely, and that's why I talked about the spend comparison side. So the spend comparison side, and I've seen it with clients many times where they've had a hospital contact them and say, we've seen this is the benchmarking price, why are we paying this price and why are we seeing another price? And what I've seen quite a few of my clients do is actually then work out, and rather than having a bigger scale of pricing between hospitals, that we are seeing more comparative pricing. And for example, Wales have had it for a really long time. In Wales, you can only sell your product at one price, one Wales, one price. And that's almost like their strap line. You know, they've been very clear that the products do not change in price from hospital to hospital. So companies have to accommodate that, knowing that one hospital may buy less and another may buy more. To be honest though, on the flip of that, we do see hospitals where maybe they are doing an awful lot of maybe research or clinical trials for an organisation, and while the product price may stay the same, it might be that they are able to benefit from free of charge product to help support those clinical trials or those evaluations. And so there are ways that suppliers can reward, as it were, those hospitals that are benefiting them more.
Yeah, that's really interesting. So the days really of going around and trying to do deals are sort of over, and I'm sort of, I think that's a great thing. I mean, you know, I run a vascular company for a number of years here, and we'd sell the product for the same price. My theory was that's what the value of it is, and in fact, one of the hospitals, funnily enough, in London had said to me, "We are the best unit in the country. We'll want the best price." And I said, "You're all part of the NHS, and you'll pay what everybody else pays." But that's really, really interesting how things have tightened up there. It's been a real eye-opener listening to this. The other big thing, I mean, a lot of these policies that you mentioned, I mean, a lot of the companies that may be attending are just, you know, coming back into hospitals again following, you know, COVID-19 and starting to re-engage with the healthcare system. I mean, there's things happening like at the end of this month, the 30th of September deadlines, and all of these policies around slavery, and in particular, and one thing that I will be doing a webinar on in the very near future about this whole carbon neutral challenge. I mean, that's a huge thing, and from what I'm gathering, and I've had so many conversations about it with people over the last few weeks, and you mentioned it before the meeting, that if you can demonstrate environmental benefit, it's part of these hospitals' agendas to show that they are helping to save the planet and be green. So you said it could mean quite a meaningful chance of them winning tenders if they do meet that criteria.
It absolutely can. So for example, I'm working with a client at the moment who's been awarded on a framework. So there are multiple suppliers who all have the same product on the NHS supply chain framework. And my client's been approached because their product shows a carbon saving. So rather than going with we used to go with business plans and say, if you buy our product, it will save you X amount of pounds. And we also used to do it in theatre time, for example, as well. And what we're being asked to in this is we're actually saying, how much carbon can we save you? Because the hospitals have got carbon reduction plans in place already, and they are having to reduce their carbon. So what NHS supply chain have asked this particular client of mine to do is say, tell us, if we buy this product, how much carbon can a hospital do? And we can then tell each hospital how much carbon they will save by swapping to your product. And it's a big amount. And so it's a totally new way of presenting a product that we've not done before.
Yeah, I think it's becoming, I mean, I have very regular calls with NHS operational managers, because I want to know what's happening on the ground so I can help, you know, we can help clients to engage better, particularly when, you know, medical devices, let's face it, it was ventilators and diagnostics that helped save a lot of lives at the beginning of the pandemic. It wasn't the vaccines, it was medical devices. So I think we should all be very proud of the industry that we're in. But I mean, at the end of the day, you know, this whole change in the NHS and the way that you engage with the NHS is so different to how it was 18 months ago. And the sort of work we do, I mean, you mentioned earlier about hospitals saving money. I mean, hospitals are businesses, they want to generate revenue. The most important thing for hospitals to do at the moment is to rise to the challenge of this 5.5 million patient waiting for elective surgery, which is a huge challenge to them. And what they're looking for is operational gain. So anything that keeps people out of hospital, anything that reduces length of stay, anything that reduces readmissions, complications, they're really very valuable, particularly if you're able to save beds. So the job of a salesperson now is changed so dramatically. And I think that years ago we used to we used to talk to clinicians and show them products, and they used to then be the champions of those products to the other departments of the hospital, to the business managers, to the theatre managers, to the procurement managers, saying, hey, look, I want that. It's not as straightforward as that. We're expecting our clinicians to be able to go in and talk about environmental and upsell that. We're really in the role of medtech now in engaging with our healthcare system has become multifaceted in terms of the knowledge transfer we need to give those customers to enable change in their hospitals. And it's not just, this is a box of 10, we'll give you a box free if you buy 20 and all this nonsense. It's more than cost saving. It's highly complex, particularly, as I say, when I look at the, how on earth do companies work out their greenhouse gas emissions? How do they show their carbon reduction plans? I mean, this, for some of those smaller companies out there, they may struggle to actually be able to answer these tender questions. And of course, talking about the weight of the benefit of having that knowledge and putting that information into the tender document so you're at the top of the pile for consideration is going to be so important for many suppliers. So yeah, it's I've learned a great deal from this, Sarah, and it's been really great to have you on. I do have a question. Do I have a question? I'm just seeing if I got anything in the chat box here. Yes. So Messi, one of the participants have asked, you've mentioned carbon, etc., but not packaging and device packaging waste is dramatically high. In what way do the NHS want companies to combat this? There you go.
Okay, yeah. So we didn't mention every element of what that means with carbon, and this is definitely right up there on the agenda as well. And in tenders, as I said, I'm a tender bid writer. We have seen multiple questions for the last 18 months now, very specifically on packaging and device packaging and plastics and what your products are made of. So I'm working with suppliers to try and make sure that they start documenting what is your packaging made from. So can you make your packaging out of recycled material in the first place? When your packaging then goes to the end user, how much can you reduce it? And if you reduce it, record that reduction, because you can then demonstrate that in a tender that you've made an improvement. When the packaging then gets to the hospital, can it then be recycled at the other end? And how is that recycled? And we talked earlier about suppliers are having to engage with the rest of their supply chain, and this is having a big knock-on effect. NHS supply chain and the procurement bodies are engaging with us as suppliers, as tier one. We then have to engage with our tier one suppliers. Then down the line, where are the products coming from further down the line? And it goes down your tiers of your supply chain, and these are questions that people are going to have to start asking. So if you are a distributor of products, you're going to have to talk to all of your different suppliers and then their manufacturers. If you're a manufacturer of the product yourself, where are you buying your raw materials from? Who's producing your raw materials? Where are they coming from? Are they coming from sustainable sources? And if they are, let's evidence that, let's document that, and then let's show that in a tender bid. Because some of these things suppliers are doing, but they're just not documenting it, or they haven't got records of it. So one of the things that I do with suppliers is I ask the question and then I say, show me, let's evidence it, let's put it together. And then let's then shout about it and tell the contracting authority in our tender bid that we have changed where we buy one of our raw materials to a more sustainable source. And we've reduced our packaging, and we're now using a packaging material that is already made from recycled goods, and we've reduced it by 20%. Let's start looking at these things and telling them, and telling that story in our tender bids, because that will score points. And that could be the difference in the future. That could be the difference between being awarded onto a framework or not. They are being very clear that there are lots of suppliers selling lots of products, and they're being very clear that if you are not on this journey with them, they will not buy from you anymore. They will find somebody else. You're on mute.
Yeah, I'm on mute. Famous. Yeah, I mean that's absolutely incredible. So yeah, so these companies are really going to have to understand their whole carbon and production. I mean, in the last, as I say, in the last couple of weeks, I've had several things come in my direction. We'll definitely be doing something on this subject. I've reached out to NHS England, and we've got a podcast coming up, webinar coming up on this real subject to sort of see, because there's a load of companies out there that have moved to single-use disposable products. I mean, this is where, in one hand, this is what the NHS wants. They don't want to reprocess things because they can open them up and use them, and they don't have to depend on sterile services that are overwhelmed as it is. And, it only takes a sterile services department to break down, a reprocess to break down, and then the hospitals actually, they have to cancel operating lists, and the knock-on effect of that is huge. But we're now maybe going back into that world of reprocessing because of the environmental impacts of single-use disposables, and there has been, as you know, a huge growth in disposable single-use devices. So that's been really, really interesting. Well, I just wanted to thank you, Sarah, for joining, and for the participants today. This is going to be on Spotify and the Apple Store as a podcast, so listen into that. I'm going to put this on YouTube, and I'll send the link in on LinkedIn, so those that are attending, if they all want to pass it on and share it with other members of the team. But we're here to help. Contact us at Device Access. We're delighted to help you out with your procurement challenges. And I just wanted to thank Sarah again, and thank all the participants for listening today to our podcast, webinar today on procurement. Thank you, Sarah, for such detailed information, and see you all again. Thank you.